Thank you so much, Georgia, and welcome, APHA. I am so delighted and so humbled to speak before this great gathering of public health leaders from across this nation, because you are professionals who make things happen. You know, it's been said that there are three types of people in the world: those who make things happen, those who watch things happen, and those who ask, what happened? You are definitely in the first group. You make things happen. Why? Because you stand for something. And as the old saying goes, if you don't stand for something, you'll fall for anything. We have come here to Denver, to APHA, because we are standing together. We are standing together to re-energize our spirit and reaffirm our commitment. We are standing together because it is absolutely critical to keep our public health community strong as we embark on the next chapter of our public health journey during this unprecedented time. We've had quite a journey to take us up to this point. Some would say it's the journey of Christopher Columbus. When he left, he didn't know where he was going. When he got there, he didn't know where he was. When he returned, he didn't know where he had been. Each of us has a unique journey. And for me, today, at this moment, I feel so grateful because my journey has brought me here to you. My journey started a generation ago when my parents immigrated to this country from Korea searching for the American dream. I can remember so clearly how almost every day they told me and my siblings how lucky we were to be born in this great country, how blessed we were to enjoy democracy and freedom, how essential it was to give it everything we could in everything we did and reach our full potential in life. And most importantly, they told us how critical it was to live a life of meaning and of higher purpose. And so my journey took me first to medical school and to a career as a physician and a clinician, where I had the privilege of being a healthcare provider for over 30 years. But along the way, because of many of you, I also became part of this greater journey of public health. First, as the Commissioner of Public Health for the state of Massachusetts from 1997 to 2003, multiple governors, by the way, and later as a researcher and professor at the Harvard School of Public Health. But now the great privilege of my life is to serve this great country and to serve you as the Assistant Secretary for Health, and to work shoulder to shoulder with each and every one of you as we try to help all people reach their highest attainable standard of health. I love that phrase from the World Health Organization. Thank you. We are working hard together here in Denver and beyond because we appreciate how important and critical it is to help each person reach their highest attainable standard of health. Because we understand so profoundly that good health is a gift. We have it today. We hope we have it tomorrow. It is precious and precarious, and the only way to protect that gift is through public health. What I so respect about this gathering of public health leaders is that we have joined together in this common journey after addressing several common questions. How do we make a life and not just a living? How do we live a life that's good and not just a good life? In response, I know that we have chosen, but more importantly, many of us feel called to this incredible profession of public health. It's an incredible feeling to be called to this indescribable profession. Something seeps into your soul and won't let go, and that's why we are here. And together we have seen suffering and tried to heal it, seen pain and tried to prevent it, seen health inequity and tried to end it. Many of us are wounded ourselves, but we have decided to turn pain into power, and so we are wounded healers. And in meeting so many of you along my journey, what impresses me so much is I can't think of a field that more beautifully captures passion and compassion, because we understand so profoundly that the word passion means to suffer, and the word compassion means to suffer with. A major reason we have gathered at this meeting today is to strengthen our commitment to fully and completely implement the Patient Protection and Affordable Care Act. Thank you. Thank you. And I want to thank you for making this happen. I want to thank you for your support. Because of your dedication and your perseverance, the Affordable Care Act is now the law of the land. Thank you. We all understand that the Affordable Care Act is a transformative opportunity for our nation. Because of it, we will bring coverage to millions. We will build true systems of care. We will highlight the power of prevention and public health for the whole nation to see, and we will bring health security to every American family. Thank you. Rest assured, fully implementing the Affordable Care Act will not be easy. And I believe at crucial times like these, we are being tested for our level of commitment. Yes, we have some giant obstacles before us, but as my good friend, the late Reverend William Sloane Coffin, liked to say, giant obstacles are brilliant opportunities, brilliantly disguised as giant obstacles. So I believe that the brilliant opportunity right now before all of us is to renew our commitment and renew our efforts, support the full implementation of this law, and I believe passionately, as you do, that the Affordable Care Act will always be remembered as a historic investment not only in human health, but also the human spirit. So stay strong. As Disraeli has said, the secret of success is constancy of purpose. That's our challenge and our opportunity right now. And while we retain that constancy of purpose, it's also very important to stay flexible. As it says in the good book, blessed are the flexible, so that ye shall not be bent out of shape. So thank you, APHA. Thank you for your dedication to public health. Thank you for your leadership in rebuilding and re-energizing our community. Thank you for your passion and compassion. Have a wonderful conference, and God bless you all. Thank you very much. Thank you.